The call came on a Tuesday morning. Maria's son, David, just 22, was gone. He had been at a friend's party the night before. He seemed fine, they said, just tired. He went to sleep on the couch. He never woke up. The shock was a physical blow. It stole the air from Maria's lungs. Her bright, vibrant son, full of dreams and laughter, was no more. The toxicology report delivered the devastating answer: fentanyl. A word Maria had heard on the news. David wasn't a known drug user. He experimented once, perhaps twice. He thought he was taking a recreational pill. He had no idea it was laced with a killer. This potent substance was an invisible assassin. It had crept into their lives. It left behind a chasm of grief. Fentanyl's danger lies in its hidden nature. It is often pressed into counterfeit pills, made to look like legitimate prescription medications. Young people, especially, might seek these out, unaware of the lethal gamble they are taking. This is not just Maria and David's story. It is a story repeating itself across the nation. Families are being torn apart. The silent killer, fentanyl, does not discriminate. Understanding this personal toll is the first step. It demands our attention and action. The fentanyl crisis did not appear overnight. It grew from roots planted decades ago. It began with prescription painkillers, opioids like OxyContin. These drugs were marketed heavily. Pharmaceutical companies told doctors they were safe. They said they had a low risk of addiction. This was not entirely true. Doctors began prescribing them for many types of pain, chronic back pain, post-surgery recovery, even moderate ailments. These medications offered relief, but they also carried a hidden hook, a powerful potential for dependence. Many people found themselves ensnared. They took the pills as prescribed, yet their bodies grew tolerant. They needed more for the same effect. Addiction began to take hold, quietly, insidiously. Patients became dependent. They were not seeking a high. They were seeking relief from pain, or trying to avoid withdrawal. The medical community was slow to recognize the scale of the problem. Prescriptions continued to flow. The seeds of a national crisis were sown. Eventually awareness grew, regulations tightened, doctors became more cautious. Prescriptions became harder to obtain. For those already addicted, this created a new desperation. Many turned to heroin, then fentanyl entered the illicit drug supply. The stakes became lethally high. Fentanyl is a synthetic opioid. Made in a lab, it was developed in the 1960s for severe pain, especially in cancer patients. In prescribed forms, it's safe under supervision. It binds to opioid receptors in the brain, controlling pain and emotions effectively. Fentanyl is 100 times more potent than morphine. Its strength makes it dangerous in the illicit market. Just 2 milligrams can be fatal. Illegally manufactured fentanyl is a major threat. The statistics surrounding fentanyl are stark. They paint a grim picture of a nation in crisis. But behind every number is a human story, a life cut short, a family devastated. Consider the 17-month-old boy in Los Angeles. He died after accidental exposure, or the 15-year-old girl in Georgia. She took a pill she thought was something else. These are not isolated incidents. They are heartbreaking examples of fentanyl's reach. Each death leaves an irreplaceable void. A community mourns. Potential is extinguished. The true cost is measured in these lost lives. In 2024, fentanyl remained the leading cause of overdose deaths in the United States. This is a sobering fact. Even as overall drug overdose deaths saw a significant decline that year. A hopeful sign, yes, but fentanyl's shadow still loomed large. It continued to be the primary driver of fatalities. This underscores the drug's extreme danger. Its pervasive presence in the illicit drug supply. The fight against it is far from over. The numbers tell us that vigilance is paramount. The progress made is fragile. These statistics are more than just data points. They reflect the pain of countless families. The shadow economy: fentanyl's profitable path. Fentanyl's dominance in the illicit drug market is driven by basic economics. Its extreme potency is a key factor. Only very small amounts are needed to produce an effect. Traffickers can transport large doses in small packages. A kilogram of fentanyl can be stretched much further than heroin. It also increases profit margins significantly. For criminal organizations, fentanyl is a highly attractive product. It offers maximum return for minimal volume. The production of illicit fentanyl is also relatively inexpensive. Precursor chemicals, the building blocks for fentanyl, are often sourced from China. These chemicals are then synthesized into fentanyl. This often happens in clandestine labs run by Mexican drug cartels. These cartels control vast distribution networks. They move the fentanyl across the border and into cities and towns across America. The low cost of production combined with high potency makes fentanyl incredibly profitable. This profit motive is a powerful engine. It drives the continuous flow of the drug. Users are often completely unaware they are consuming fentanyl. They might purchase what they believe to be heroin or a familiar prescription pill from an illicit source. Instead, they receive a product laced with a far more powerful and potentially lethal substance. This practice dramatically increases the risk of accidental overdose. A crisis across communities, disparate impacts. The fentanyl crisis does not recognize geographic boundaries, nor does it limit itself to specific demographics. It is a scourge that has touched virtually every corner of American society. From bustling urban centers to quiet rural hamlets, from affluent suburbs to economically challenged neighborhoods, no community is immune. The widespread availability of fentanyl, often disguised or mixed with other drugs, means anyone who uses illicit substances is at risk. This broad impact makes it a truly national crisis. It requires a comprehensive, nationwide response. Younger populations have been hit particularly hard. Fentanyl is now a leading cause of death for Americans aged 18 to 44. This is a shocking statistic. It highlights the vulnerability of young adults. Many may be experimenting with drugs for the first time, or using them recreationally. They may be unaware of fentanyl's presence or its extreme potency. The loss of so many young lives has devastating consequences. For families, for communities, for the future of the nation, their potential is tragically cut short. The fight against fentanyl requires tailored strategies. Continuous monitoring and flexible responses are essential. The front lines, battling the fentanyl flood. The battle against the fentanyl crisis is being fought on multiple fronts. Law enforcement agencies play a critical role. They work to disrupt the flow of illicit fentanyl into the country, and to dismantle the trafficking networks that distribute it. Seizures of fentanyl and its precursors at the border have increased. Arrests of high-level drug traffickers are also part of this effort. These actions aim to reduce the supply of fentanyl on the streets. This is a dangerous and difficult job. It requires constant vigilance and international cooperation. Public health initiatives are equally vital. Expanding access to addiction treatment is a cornerstone of this approach. This includes medication-assisted treatment, or MAT. MAT combines medications with counseling and behavioral therapies. It is highly effective in treating opioid use disorder. Another key strategy is increasing the availability of naloxone. Naloxone is an overdose reversal drug. It can quickly restore breathing in someone who has overdosed on opioids. Making naloxone widely accessible to first responders, community members, and families saves lives. It is a critical emergency tool. Harm reduction strategies are increasingly recognized as essential components of a comprehensive response. A glimmer of hope. Turning the tide through collective action. Despite the immense challenges posed by fentanyl, there are tangible signs of progress. A significant development emerged in 2024. The United States saw an estimated 27% decline in overall drug overdose deaths. This was a remarkable shift. It came after years of devastating increases, particularly during the pandemic. While fentanyl remains a primary concern, this overall reduction offers a glimmer of hope. It suggests that concerted efforts are beginning to yield positive results. This is a testament to resilience and hard work. This hopeful trend is not accidental. It is the result of deliberate actions and multifaceted strategies. The Biden administration has focused on several key areas: seizing more fentanyl at the southern border, cooperating with China to curb the export of precursor chemicals, arresting high-level drug traffickers. These efforts aim to disrupt the supply chain. At the same time, there has been a push to expand access to addiction treatment. and to embrace harm reduction organizations. These groups provide vital services on the ground. They reach people often missed by traditional systems. International cooperation plays a crucial role. The fentanyl problem is not confined to one country. Precursor chemicals often originate in one nation. Manufacturing may occur in another. Finding help, finding hope, resources, and the road to recovery. The journey out of addiction can be difficult, but it is important to remember that addiction is a treatable medical condition. Recovery is achievable. No one has to face the challenges of fentanyl or other substance use disorders alone. Help is available. Reaching out is the first, brave step towards a healthier future. Many people have successfully navigated the path to recovery. Their stories are a testament to the resilience of the human spirit. They show that a life free from addiction is possible.